Hello everyone. I'm going to discuss mucormycosis. In the current scenario, you must have heard about the mucormycosis after the COVID-19 recovery in various persons. Basically, what is mucormycosis? It's a type of basically a clinical syndrome caused by a number of fungal species which basically belongs to the order Mucorales. They are also known as mucormycosis is also known as zygomycosis. And some of the responsible common examples of the fungi which are responsible for the mucormycosis are Rhizopus, Mucor, Rhizomucor species. So these three are the three common fungi which are responsible for the mucormycosis. And basically spores of this fungi can rapidly or are basically found in soil and rapidly uh, can disperse spores in the surrounding environments also. But you must remember one thing, that these fungi do not spread from one person to another. Okay, so basically, what is the reason behind the spread of the disease? There may be numerous factors. Okay, and mucorales are sufficiently different from other fungi also. Okay, they belong to Zygomycete group. Now, epidemiology. Okay, so where are they found? They are commonly found in the soil, and clinically they are limited to the immunocompromised patients and the patients who had organ transplants. And all members of this group are basically found in the decaying matter. Okay, are found decaying matter, or you can say in basically soil also. Okay, now clinically they are, as I told you, they are found in immunocompromised patients. This may be due to the trauma patients. Okay, patients who had undergone a trauma. Okay, or let's say who's under recovery uh, under the COVID, after the COVID-19 infections also, and various other immunocompromised problems also, as well as in the diabetic patients also, due to the high levels of the glucose in their body. Okay, so who are at risk basically? Okay, and what are the risk factors involved in the mucormycosis? Diabetic patients, or the patients who had undergone a immunosuppressive therapy, prolonged ICU stay. Okay, the patients who had prolonged ICU stay may also have risk of the mucormycosis. Okay, so what about COVID-19? We hear right now about the after post recovery of COVID-19 that many of the patients get the secondary infection of mucormycosis. Okay, so in the case of COVID-19, corticosteroids are commonly used. Okay, corticosteroids are commonly used in the treatment of COVID-19, and they reduce the damage caused by body's own immune system during a coronavirus infection. And as the corticosteroids are basically immunosuppressants and also increase the blood sugar levels in both diabetic and non-diabetic patients. So it is thought that both these effects may contribute to the cases of the mucormycosis. There are also other problems also, such as sometimes it may be also due to the nosocomial infections also. So what are nosocomial infections? They are infections uh, which basically are related to the infections in the hospital, which basically transfer from one patient to another in the hospitals only. Okay, so why is it fatal? Okay, first reason, it is a systematic infection. Second, it's a chronic and takes a time to cure. And as per CDC, it is a rare disease. It is a rare disease, but the death rate is as high as 54%. Okay, it's a rare disease, but the death rate is 54%. Okay, so if it means from 100 patients of mucormycosis, only 46 patients will survive. Okay, you can say like that. Okay, so basically, uh, how basically this fungi and what are the signs and symptoms which basically appear in the case of mucormycosis. So pathogenesis, starting with the pathogenesis. So infection is basically acquired via a respiratory tract or in a primary cutaneous infection also, or via inoculation of the spores into skin aberrations. Okay, and this spores basically follows the host whose immune response is deficient. That is the patients who are immunocompromised. Okay, and it occurs in the case of immunosuppressed patients, such as in the case of COVID-19. Okay, as well as in the case of AIDS patients also, who are basically immunocompromised. It's a rare infection, but the mortality rate is high. But the mortality rate is as high as 54%. So basically, this disease is divided, you can say, there are types of mucormycosis, starting with the rhinocerebral. Okay, rhinocerebral, sinuses, pulmonary, lungs, gastrointestinal systems, cutaneous, skin, and disseminated in the blood. Okay, so rhinocerebral basically deals with sinuses and the brain. So what are the symptoms of a rhinocerebral mucormycosis? Okay, a one-sided facial swelling may appear. You can see in the photographs given here. The patient may have headache and a nasal and a sinus congestion. Okay, and the black lesions on nasal bridge, you can see the lesions here, or on the upper side of the mouth that quickly become more severe, and also a fever. You can see the black lesions here. Okay, so it is found especially in the case of immunosuppressed patients. Okay, two types basically, rhinocerebral and pulmonary mucormycosis is basically found one of the common mucormycosis after COVID-19 recovery. Okay, and these both are also found in the case of diabetic patients also. Okay, and this basically leads to the septic necrosis and infarction of tissues of nasopharynx as well as orbital patients. So, and sometimes it also leads to cellulitis. What is cellulitis? Orbital cellulitis, basically it's an inflammation around the eye tissues. Here you can see the inflammation here. Okay, so this fungi are basically highly invasive. Okay, they eat up our tissues and spread to the various parts of our body. Okay, and as the infection progresses, the fungi invades the other vessels, which may also lead to retinal artery thrombosis and also visual impairment. Okay, so this can be diagnosed using X-ray as well as CT scans also. And next comes the pulmonary, okay, which the common symptoms are basically the mild fever, shortness of breath, cough, and chest pain, and also hemoptysis. What is hemoptysis? It is basically coughing of blood originating from the respiratory tract. So when you cough, the cough may have drops of blood. Okay, and it is involved with the respiratory system. Next comes this one is also associated as a common form of mucormycosis after COVID-19 recovery. Gastrointestinal one. Okay, the common symptoms are abdominal pain, nausea and vomiting, as well as the gastrointestinal bleeding due to the spread of the mucormycosis. And it is normally found in the case where there is renal transplant or due to the malnutrition also. Another you can say other problems, if the infection progresses, it may also invade other tissues also. Okay, next comes cutaneous. In this case, mucormycosis spreads after if there is any tissue injury in the skin or burns in the skin. Okay, so cutaneous mucormycosis basically looks like blisters or ulcers or infected area uh, which may turn black. You can find, just search Google for mucormycosis, where you can find out the what are blisters and ulcers. Okay, so these symptoms also include the pain in the blisters in the skin, as well as the swelling around the wounds also. Okay, so outbreaks of the cutaneous disease may also lead to a cellulitis. Okay, and may this organism also penetrates deeper into the skin, may also lead to the vascular invasion. Okay, and in the progression it may also lead to the chronic ulcers of the skins also. Okay, sometimes it is also related to the trauma conditions such as any injury also. Okay, and also sometimes due to the insect bite also, but insects are not the carriers, but if the there is any problem due to the surrounding problems, the infection may spread. Okay, next comes the last one. There are also other types. This one is a disseminated mucormycosis. It occurs when infection spreads through the bloodstream to affect another part of the body, and the infection commonly affects brain, but can also affect organs such as spleen, heart and skin. So disseminated mucormycosis, the infection may occur during the organ transplant also. So at the time when organ is transplanted, when body is still trying to identify a new organ. Okay, there are, due to the use of immunosuppressant drugs, okay, there are chances that this mucormycosis may infect the blood, okay, and enter the bloodstream. Okay, so when to suspect that a particular person is having a mucormycosis or not, as per ICMR guidelines, the criteria given here is as per ICMR guidelines. In the COVID-19 patients or diabetic or immunosuppressed individuals, sinusitis, the first one is sinusitis. Okay, a nasal blockade or a congestion, nasal discharge, it may be black in color or it may even have a blood. Okay, and the local pain on the cheekbone, one-sided facial pain, numbness, even the swelling, blackish discoloration or the bridge of a nose palate, toothache. Okay, loosening of a teeth, jaw involvement, pain. Sometimes also there is a problem in your vision also. It may be blurred, or you may have a double vision with the pain in your eyes. Skin lesions also. Sometimes necrosis is also found. Okay, and also other symptoms like chest pain, and sometimes you may have problems in the breathing also. Okay, these are the signs or symptoms, you can say, you can suspect, okay, after as per ICMR guidelines. Okay, now how can you diagnose the mucormycosis? Diagnose basically rest on signs and symptoms as well as by identifying the organism by tissue biopsy, microscopy, and fungal culture. Okay, so this can be done by using a staining techniques, okay, and the tissue biopsy. Let us see some of the photographs of the pathogens involved in the mucormycosis. Rhizopus growth on agar plate, and this photograph is of a Rhizopus species. In the case of mucormycosis, showing broad ribbon-like aseptate hyphae, okay, and the stains which is used here is hematoxylin and eosin. Okay, sometimes you may also need the imaging test such as CT scan of your lungs, sinuses, or other parts of the body. So depending on the location of the suspected infection, okay, in order to check how far has the infection progressed. Next comes the mucor. Check out the feature on agar plate, microscopic photograph. Rhizomucor species, okay, so the common fungal pathogens involved in the mucormycosis. And that now comes the treatment. In this case, a liposomal amphotericin B is used for the treatment, and sometimes surgical debridement of the necrotic tissue if needed, and this treatment basically lasts several weeks to several months also. So what is surgical debridement? It is basically removal of the necrotic tissue, okay, necrotic tissue, okay, because if we do not remove this tissue, there are chances that it may spread to the other tissues of your body, okay, but it depends on the stage and the progression of the disease. Okay, so what is the basic mechanism of the liposomal amphotericin B? It basically disrupts the cell membrane, okay, it acts as inhibitors of ergosterol synthesis, and basically it directly damages the membrane. And control, as per ICMR guidelines, control the hyperglycemia, that is control your blood sugars, okay, monitor glucose level post COVID-19 discharge, and also in the case of diabetic patients, use steroid judicially, use it properly, correct timing, dose, do not overuse the steroids, use clean sterile water for humidifiers during oxygen therapy, and proper use of antibiotics and antifungals. Okay, so this is how we can control the mucormycosis. If you have more questions regarding mucormycosis, you can please ask your questions in the chat. Okay, and thank you. If you want to download this slide, okay, please download the Science Edutech app and also subscribe my channel. Okay, thank you.